Hello everyone, this is Renu Karmacharya and I'm presenting my case study. Case study for Inova Fairfax Hospital versus its competitor hospitals on emergency care. This case study is for HEP 725 course in George Mason University. This course is taught by Dr. Farrokh Alemi and Dr. Maria Uriyo. Source of data. The data were collected from hospital compare dataset from data.medicare.gov, and you can see the screenshot of the website. The data for the study were available from January 2015 to June 2019. Why Inova Fairfax Hospital? Inova Fairfax Hospital is Northern Virginia's leading nonprofit healthcare provider, recognized in 2019 by U.S. News and World Report, which named Inova Fairfax Hospital the #1 hospital in the Washington, D.C. region. Inova Hospital holds 5-star ranking from the Centers of Medicare and Medicaid Services, CMS. Inova Fairfax Hospital was named to the Fortune IBM Watson Health 100 Top Hospitals list, ranking in the top 10 nationwide among major teaching hospitals. It has 923 beds serving Northern Virginia, Washington, D.C. metro area, and beyond. These are the competitor hospitals of Inova Fairfax Hospital. MedStar Washington Hospital Center is the largest private hospital in Washington, D.C. It is a non-for-profit hospital center licensed for 926 beds. Western Hospital Center is a for-profit corporation with 187 beds. Centera Northern Virginia Medical Center is a non-for-profit hospital in Prince William County. It is the smallest hospital compared to other competitor hospitals in the study. It has only 183 beds. Virginia Hospital Center is a not-for-profit hospital with 365 staffed beds. List of measures and data availability. All these measures are related to timely and effective care on emergency care. The first measure is emergency department volume. Data were available from January 2015 to December 2018. Second measure, average time patients spent in the emergency department before they were admitted to the hospital as an inpatient. Data available from October 2017 to December 2018. Third, average time patients spent in the emergency department after the doctor decided to admit them as an inpatient before leaving the emergency. Data available from October 2017 to June 2019. Fourth, average time patients spent in the emergency department before leaving from the visit, psychiatric/mental health patients. Data available from October 2017 to June 2019. Fifth measure is average time patients spent in the emergency department before leaving from the visit, and data were available from October 2017 to June 2019. There are some limitations of the study. The first one is data were not available for every time period. Only 5 measures were examined related to timely and effective care in emergency care, which is not enough to determine the performance of Inova Fairfax Hospital compared to other hospitals. Some of the data in the dataset were duplicates. Some data were in a range form, which were non-numeric. For instance, there were ranges from 40,000 to 50,000, and some of the score were saying high or very high, and so on. Um, Last but not the least, the compared hospitals are not similar in size. For instance, the Inova Fairfax Hospital and MedStar Washington Hospital were about the same size in beds, which were 900s, and the other three hospitals in the study were much smaller than Inova Fairfax Hospital. This is my first control chart for emergency department volume. Data were available for only 4 time periods for this measure. The first 2 time period were above the upper control level, meaning there were very high emergency patients during this time period, and it's followed by other 2 time periods which were on upper control limit, which is 60,000 in this time period, in the third and fourth time period. Second measure is um, for Inova Fairfax Hospital compared to its competitor in average median time patients spent in the emergency department before they were admitted to the hospital as an inpatient. Data were available for only 3 time periods for this measure. Um, all 3 times period were within the control level, um, where the second time period from January 2018 to December 2018 is slightly above the other 2 time period. Third measure is for average time patients spend in the emergency department after the doctor decided to admit them as an inpatient before leaving the emergency department for their inpatient room. Um, Data were available for 4 time periods, and all the 4 time periods were within the control limit. The first control limit from October 2017 to September 2018 was the highest among this 4 time period, um, and the level slightly decreases throughout the year until the fourth time period from July 2018 to June 2019, um, meaning Inova Fairfax Hospital were not doing better on their emergency service for the timely care um, um, during during these study time periods. Fourth measure is for average time patients spent in the emergency department before leaving from the visit, psychiatric, mental health patients. Data were available for 4 time periods. All these time periods were within the control limit. Um, um, the first control limit, the first time period for October 2017 to September 2018 started slightly below the other below compared to the other time period, and Inova Fairfax Hospital um, did better gradually throughout the year um, till the last time period from July 2018 to June 2019. In this time period, Inova Fairfax performed very well, taking care of their psychiatric patient in the emergency department um, with the control limit being slightly below the upper control limit or upper control level. Fifth measure is for average time patients spent in the emergency department before leaving from the visit. Data were available for 4 time periods, and all the time periods were within the control limit. Um, Inova Fairfax Hospital performed better throughout the year with the increase in the graph. Um, Summary, for all the four, the majority of the measures of the study, which were for average time patients spent in the emergency department, were within control limit, except emergency department volume. Emergency department volume, there were two time period which were above the upper control limit, where the Inova Fairfax Hospital's emergency patients volume were much higher compared to the other competitor hospitals. These are my references. Thank you.